Hello, everyone, and welcome to another episode of the Money and Mindset podcast. I am your solo host today, Sharika Alford. The lovely Anntricia Bray Smith will not be joining us today, but nonetheless, we are pleased to say that we have our guest, Jim Blankenship, back with us. If you did not catch episode number 9 during season 3, do go back and listen to that. We discussed understanding Social Security, and Jim was nice enough to agree to come back and talk to us all about Medicare on today. Before we jump in, let me just remind you, give you our disclaimer. The views expressed by the host and the guest on the Money and Mindset podcast are for entertainment and informational purposes only and does not constitute any financial, legal, or other type of advice. So let's welcome Jim Blankenship today. Hi, Jim.
Hello, how are you?
I am doing well. Thank you so much for coming back.
Oh, it's great to be here.
Yeah, Medicare.
Yes, yes.
I see that on my check stubs, I see under the tax section, every time I get a paycheck, there's some deductions that come out for federal Medicare.
Absolutely.
I just want to jump in. Does that mean that Medicare is going to be free for me whenever I get to that point of needing it?
Well, that's one of the misconceptions that a lot of people have is that Medicare itself is free. Um, in a way, it's partly right, and in a way, it's partly wrong. Um, you have paid for Medicare all along, as you say, through your payroll deductions. When you get to that magical age of 65 and you're eligible for Medicare under the old age component, Part A, which is hospital insurance, does come to you without any additional cost. So you've paid for it all along, and now you're eligible to receive this without any additional cost. There's a second component, though, which is called Part B. And this covers all of the physician costs and various other different things that make up our healthcare regimen. And Part B has a premium associated with it, which is, and I apologize for not looking this up before I came, but it's roughly $135 a month. And that typically is withdrawn from your Social Security check if you're receiving Social Security. If you're not yet receiving Social Security, then as you're enrolled for Medicare Part B, you would need to pay that premium separately. So the Part B component does have a premium that you have to pay on a monthly basis. And so you can see why the answer is partly yes and partly no.
Yes, thank you for clearing that up because y- y- you know, I'm fortunate in that I'm in this space, so I get to speak with guests like you to find out this information way in advance, because you kind of want to know the rules of the game and how it's played before you jump out there. And
Absolutely.
I can only but imagine people, there are probably folks out there that assume, hey, I'm paying all this money in each paycheck, and so once I retire and file for Medicare, then I'll be taken care of. And whoa, you find out that that's not the case.
Yes, yes. And actually, that brings me to the second point, which is Medicare doesn't cover everything. In fact, it doesn't cover everything by a long stretch. There are, as with many or most insurance plans, there are deductibles and co-payments and things along those lines that you have to make up for. And there are many, many different kinds of services and such that are just not covered at all under Medicare. So
Hmm.
that introduces a third component, which is known as Medicare supplement or Medigap. You might
Hmm.
understand, or you might have heard that phrase,
Yes.
which is an additional policy that you would purchase to sit alongside your Medicare Part A and Part B plans.
Hmm.
And those Medigap plans typically make up the gaps. They pay They may pay the deductibles, they may pay the co-insurance, they may pay a portion of those items. There are 10 different levels of Medigap plans,
Whoa.
and they're all based on letters, so it makes it even more confusing. You have Part A and Part B of Medicare, but then you also have Plan A, Plan B, Plan C, Plan D. There are
Oh,
many other different kinds of plans that go into it. So it really, really pays to get to know your insurance broker at this time when you're looking at your Medicare options, to see what kinds of Medigap plans could be available to you, and how, what really makes good sense for your situation, because not all plans, of course, are the same. As you as I'm sure you would understand, various different plans will have better coverage for certain situations. If you have a lot of prescription drugs, for example, you're going to want to choose a plan that covers your prescription drugs in the particular formulary that you need. So there's a lot to consider as you're going into Medicare age.
oh gosh, this is starting to sound like alphabet soup.
Yes, it definitely is.
Now, I know that on our show, we're just discussing high level things, but you actually have a book, a Medicare owner's manual.
Yes, as a matter of fact, this is a copy of it right here.
Okay. And you go into detail about the different coverages and what can one
Yes.
expect if they were to purchase your book and how can they purchase it?
Yes, absolutely. One of the sections in the book specifically goes over all of the various different Medigap plans, as well as the decision-making process as to whether or not you would want to go with the Medigap plan, or there's yet another component of um, Medicare called Part C, which is Medicare Advantage, which is a kind of an all-encompassing plan that covers up a lot of the gaps and such on that original Medicare Parts A and Parts B. But in addition, there are sections in the book that speak to, for example, the enrollment periods. One of the questions that we run across all the time is, I'm nearing age 65. When should I enroll for Medicare? And there's a specific time period that you're eligible to be able to enroll. And if you don't get enrolled during that time period, unless you have what they call creditable coverage, you could be subject to a penalty that would last for your entire life on your Medicare Part B premium. So,
So can you tell us when, I mean, when should we look at enrolling? Is that the same for everyone or how
well,
does it work?
it varies by the individual, but it typically goes from 3 months before you reach age 65 until, I believe it's either 4 or 6 months, and I apologize for not having
That,
the specifics,
that's fine.
after you've reached age 65. So you have a span of time in there where the penalties wouldn't apply if you did enroll. But keep in mind, you don't want to wait until the end of that period, because it can take some time to understand the whole process and decide really what makes sense for you. So
Wow. I mean, could they not have made it a little bit more simpler?
well, that's part of why the Medicare Advantage, the Part C that I mentioned, that's part of why that's becoming more and more popular, because that's a sort of a standardized plan, and it's very similar. In fact, the Affordable Care Act marketplace policies are sort of modeled along the same line as the Advantage plans. So as people have become accustomed to using that sort of process for choosing a plan, the Medicare Advantage sort of fits in with that same sort of environment. And they're in fact seeing more people as a percentage choosing Part C versus going with the Medigap plan these days. So
And there's a
definitely
cost
something to
for
look
all
into.
of this. Just to clarify, there is a cost associated with all of
Right,
this.
right. It's health insurance, and you'll work with a health insurance broker or salesperson to decide what makes the most sense for you. But yes, it's definitely something that there's a cost associated with,
Okay, okay,
for
that's
sure.
good. So, audience, if you're listening to Jim tell you about this alphabet soup associated with Medicare coverage, please know this: as you are planning for your retirement lifestyle and doing your budgeting, right now you may have medical insurance through your employer, but do factor in there will be some out of pocket costs associated with Medicare once you retire. So definitely keep that in mind. Now, does Medicare cover long-term care or no?
No, it doesn't.
Mm,
There are certain components of nursing care or nursing home or nursing facility care that can be covered by a portion of Medicare Part B, but for the most part, you need to have an add-on policy. And some of the Medigap plans do include some long-term care components, but you definitely need to look that over and consider long-term care as a separate thing. Um, certainly if you're concerned about, the 3 to 5 year possibility of being in a nursing home, that's something that would be completely separate from the Medicare and Medigap kinds of insurance policies. So
okay. Now, just to circle back, and I think this is probably this may be one of the other misconceptions. We were talking about the enrollment time period, either 3 months prior to the you turn age 65 or 4 or so months after the fact.
right.
Now, none of us are automatically enrolled into Medicare, right? That's something we actually have to go in and set up ourselves.
Well, actually, if you are enrolled and receiving Social Security
Okay.
when you reach age 65, or if you are starting at age 65 on your Social Security, which is still going to be before full retirement age for a lot of people. At any rate, once you do, or if you are enrolled at that time, then you're automatically enrolled in Medicare Part A. Medicare Part B is assumed at that point, but you're not automatically in. You can still opt out. And the reason for that is, say, for example, you're still working. And if you have what's known as a creditable plan, which there's specific description of what is a creditable plan for your health insurance, that creditable plan can be left in place to take the place of Medicare Part B until such time as you leave employment. It just depends upon the circumstances whether or not. And if you have that creditable plan in place, then you don't have that penalty that I was talking about before for not filing within that set time frame.
Okay.
So when you leave employment, you have a certain set of time, certain number of months after that, that you must then enroll for Medicare Part B. So it really depends on where you fit on that scale of current.
Now, in your Medicare owner's manual, do you cover the information about the credible plans and what qualifies as a credible
Yes,
plan? Okay,
yes.
okay,
Mhm.
very good. If you're just now joining us on the Money and Mindset podcast, I'm speaking with Jim Blankenship today, and we're discussing Medicare. And we are speaking in very high level terms, but as I'm learning, the answer to a lot of the situations is it depends. And so, just like with the Social Security retirement information, the best thing that you can do is to start educating yourself early about these matters and figuring it out before it gets to that point. One way you can do that is by picking up a copy of a Medicare owner's manual by Jim Blankenship, which I believe you can get that on Amazon.com.
Yes, absolutely.
And he goes into greater detail on the ins and out of Medicare. What are some, other than what we've discussed, can within your profession, can you think of any other misconceptions or myths or anything that people may overlook until it's kind of too late as far as Medicare is concerned?
Yeah. So one of the things that people believe is that Medicare cost is the same for everyone, and it's not. Medicare is one of those government programs that is means tested, and by this we mean that if your income is above a certain level, then your Medicare Part B premium can be increased because of your income. And it's not a low number, so it it's a fairly significant number where the increases begin. For a single person, that's income over $88,000 per year. So above that level, you would have a minor increase, and I say minor, it's about $60 on top of the $135 roughly that you currently are, or that you would have if you were not subject to this increase. And for a married couple, it's $176,000. And then there are other levels that go on up, and it gets up to a point where you're paying double the amount of what the current 135 a month for everyone else that's not subject to these increases. Those are known as IRMA increases, IRMAA, and that stands for Income Related Monthly Adjustment Amount. So, thank you, government, for giving us another acronym to try to remember.
Now
So,
now those dollar amounts, is that based up on like an average over your previous earning years or the year just before? Because I'm just thinking, what if someone was maybe laid off from their job and received like a
exactly.
big severance package that
Yeah.
they usually would not receive?
So the way that works is for 2022, for example, just going into 2022,
Mhm.
the actually Social Security does this because they have all of your income records. They go back and they look at your 2020 income,
Okay.
and they compare that to their charts. And if you're above that level, then they would send you a letter that says, here's what your premium is going to be because your income was above that level.
Mhm.
That's not the end of the story, though. If you retired in 2021 or at the end of 2021, and so now 2022 is when you're officially not earning so much, you can submit an appeal and say, well, in
Okay.
2020, my income was X because I was working full time. Now my income is significantly lower than that. So please take my appeal. And quite often, if your situation is just exactly cut and dried like that, the premium is reduced back down for you and you're in good shape. You don't have to worry about it. Sometimes they won't accept that appeal because there's mitigating circumstances, something else has happened, what have you. And so you wind up having to pay that extra. But as your income increases down for maybe the following year, but keep in mind that your income, for comparison's sake, is always 2 years behind.
Right.
So as your income comes down, then your premium would level out and come back down to a lower level.
Okay.
This also happens sometimes when people retire because maybe they take a lump sum payout and that bumps up their income
Mhm.
significantly. So those kinds of situations are also appealable because your income, because of a certain situation, your income came down. Another circumstance would be a death of a spouse or perhaps a divorce. So now your household income is much lower than what it had been. You can use that as an appeal to this income related monthly adjustment amount process as well.
Okay. Okay. That very good because oof, so many things.
Right. Yes.
Oh,
Yes.
wow. Well, before we wrap up, one other thing. You have a blog site,
Yes. Yes.
and
It
what is
is
that?
financialducksinarow.com.
Okay. And what type of information can we find on financialducksinarow.com?
Well, for starters, you can find pretty much all of the information that's in all of these books. It's just scattered around in various different articles. I've been blogging since 2004, so I've got a little over 1,000 evergreen type articles out there that you can search through and research and such. But we cover Social Security, we cover Medicare, we cover income taxes, IRAs, 401ks, pretty much all of the hot buttons of things that people are interested in learning about. So,
Yep. Well, you hear that, folks? Financialducksinarow.com. It doesn't cost you anything to pull up the website and read through the
absolutely.
information. And like we say constantly, educate yourself.
Absolutely. I wanted to mention before you had very graciously pointed out my Medicare Owner's Manual book, but that's certainly not the only resource. The internet is full of resources that can help you to begin gaining an understanding. Um, uh, there's a ton of good information out there. Just make sure that you know what the source is as you're looking at it, because if it's very sales oriented, then it's going to be maybe a little bit um, maybe you wouldn't want to put as much faith in that. But spend some time looking at some other sources, bounce those ideas off of your friends that have maybe gone through the process, and you know ask questions,
Right.
talk to various different people, post a question on a message board. There's a ton of different places that you can get information.
That's awesome. That's awesome. And last time you had mentioned, I don't know, the SSA.gov website.
Right, right.
Is that like a place they can go to find out about the
Well, for
Medicare form?
Medicare, it's medicare.gov.
Okay,
That's
Medicare.
where you can find, for example, all about all of these standardized plans and the Medigap plans and such.
Okay,
You can find out about what the current premiums are for Medicare Part B and Medicare Part D, which is the drug prescription or prescription drug component of Medicare. So there's a ton of good information there to find out about how you may or may not be eligible for various different components of the plan and such. So
that's awesome. I'll be sure to put that in our show notes because
sure
this is
thing.
definitely a subject that it's not a visit it one time. This is something to
Yeah.
go over, spend a lot of time and energy and look into it and plan. So,
Yeah. In fact, some of the people that I've talked to about this and that have worked through and feel comfortable with what they've done with their Medicare plan have really taken it on almost like a part-time job to spend an hour or two a day studying and going out to these resources and bouncing ideas off and talking to the broker and all these different things so that they really have a good understanding of it as they go into it.
I believe it. Well, Jim, I really do appreciate you taking time out to come visit with us
Oh,
again
it's been a
today.
pleasure.
And
Always.
we're going to wrap up this episode of the Money and Mindset podcast. And if you guys have any questions or comments, feel free to reach out to us and send us an email at moneyandmindsetpodcast@gmail.com. And that will also be in the show notes. So send us an email and do share this episode with your family, friends, and loved ones. Because again, when it comes to things like Medicare and Social Security retirement benefits, that has an impact on all of us. And
Absolutely.
the sooner we start looking into it and learning, the better. So until next time, I'm your host, Sharika Alford, and take care.